Hey guys, I'm Dr. Ruth Roberts, the creator of the original Crock-Pot diet. Thanks for joining me today. I'm going to talk a little bit about fall allergies. So Susan wrote in and said that her pup is having actually more issues than he's had for a little bit, and she's using some quercetin and nettles and is trying really hard to not have to use any steroids to calm things down. So Susan and everybody else, here's a few tips. So we're in South Carolina. It's September. We're actually getting to the nice part of the year where it's starting to cool down. However, it's still really wet, and especially with all the rain we've been having, the mold counts are just going off the charts here. So good chance that that's a lot of what's going on as far as if you're seeing an increase in symptoms in the last several weeks. Certainly if it's been all summer long and it just is, you know, we're grinding into fall and life is tough still, then it may be due to the grass allergens. And then the other thing is too, as the trees begin to drop their leaves, we're going to start to see more itchy pets as well, simply because that's you know, all the stuff that comes down with the leaves creates some issues and things of that nature. So as far as simple things you can do at home to help decrease the difficulty your pet's having with allergies, the number one thing is to reduce the number of allergens that's on your pet's skin. And that helps in two ways. One is it stops the itchiness in the skin itself. And the second is that as your pet is grooming him or herself at night or, you know, during the day, what have you, they're ingesting those allergens. And so we forget that if they're reacting in the skin, that means that if they eat them, they're going to react at the gut level, which often worsens the skin allergies. So bathing frequently. Once or twice a week if things are really severe. I don't think you need to use a medicated shampoo, literally just something that's going to lightly clean the skin. If your pet does not have a lot of icky, gross bacterial / yeast lesions. If your pet does, often what I would recommend to people is for them to use Selsun Blue, and I think there's about 27 different varieties of Selsun Blue at this point, but choose sort of the most basic one. The interesting thing is that it's got some salicylates in it that do help with the itch, but also help to kill back the yeast. Rule of thumb for any shampoo therapy, if you're trying to make this a therapeutic thing, like your pet really does have nasty icky skin stuff, so crust scales, things of that nature, let the shampoo sit on for at least 10 minutes and then rinse off. Use much cooler water than you would for yourself, because if your pet's skin is already irritated and angry and you use hot water, it just makes it more itchy. So let the soap sit for 10 minutes, rinse off, and then you might follow that up with something that's a bit more therapeutic, so or cooling or things of that nature. So there's aloe and oatmeal. Tea tree oil based shampoos you do need to be careful with, because there is a level of toxicity with those that we don't see in ourselves, although dermatologists are seeing more people worsening their own skin conditions by using really strong tinctures of tea tree or lotions, things of that nature. Neem oil is great. My friend Mary Ernst with Earth Maiden soaps, and if you check that out on the internet, you'll find her stuff. She's got some amazing essential oil products. She's got a salve called Soothe My Doggy that has been really fantastic for, you know, different just singular spots, 2 or 3 lesions on the skin, to help dry them up. She uses calendula, neem oil, and several other things as well. So that's a great option. And then the other thing that's been very helpful, she's also got a great bar of soap that's got citronella and other sort of insect repelling stuff. So that, anyway, check it out, Earth Maiden soaps. And while you're in the bathtub, the other thing you can do that seems to really help with itchiness is to make an apple cider vinegar rinse leave-on. And basically what that is 2 ounces of apple cider vinegar in roughly a quart of water. So once you've bathed your dog, rinsed off all the soap, You've got this sitting in a jug, you pour this on in a bathtub that's got a plug on it, and just keep reapplying it and get under the chest, on the belly, under the groin, that sort of stuff, until the skin is really soaked through well with it, and then let them shake it off and towel dry from there. But the apple cider vinegar calms the skin. It's also helpful at killing microorganisms, whether that's yeast or bacteria. And then you can also make that up in a spray bottle. So if you get one of those little pint or half quart spray bottles. So again, roughly 1 ounce apple cider vinegar to 1 pint of water, and you can spritz that on specific areas that are itchy. So if they're really chewing and licking at their feet a lot, and they may not like it to start with, you can spray that area. It is generally dilute enough that it will not sting open sores, but check that out. If your dog is saying, "Hey, this hurts," then don't. And that's where you could use a more soothing type of salve to help kind of calm things down. So that's very helpful. The other thing is that when your pet goes outside, every time, wipe their feet off when they come back. There we go. Sorry, I had a little glitch in the wireless. So wipe their feet when they come back in so that you're literally removing the antigens off of their feet. I would also suggest taking a damp washcloth or hand towel and literally wiping your pet down once or twice a day, again, to pull the allergens off of their skin. So that's over the top of the back, down the legs, the feet, and then don't forget the having poor connection, but chest and belly as well, so that you get all the scrunch off of them, and that really helps to reduce the itchiness as well. If you are not familiar with quercetin and stinging nettles, I can't recommend that enough. It does seem to offer quite a bit of relief for allergies and things of that nature. So there you're looking for, there's a product on my website, the Original Crock-Pot Diet, called Allerall, and that has a little bit of zinc in it as well, which is not a bad thing short term for skin. So the goal dose for, say, roughly a 40 or 50 pound dog is going to be about 200 milligrams of quercetin and 200 milligrams of stinging nettles 2 to 3 times daily to help with the itchies. You can always use Benadryl as well, although that ends up creating some dryness. And then finally, if your pet has had just horrible allergy issues and they're getting worse over time and the symptoms are escalating, you're having to treat more often, and there's Susan, so hopefully, Susan, you can go back and listen to this because I'm getting you some info on that for Mr. Rico. So the other thing is allergy testing. I can't recommend that strongly enough, especially if you're in an area where mold and dust mites are a big issue, because that's the other thing we're seeing problems with this time of year. The upside is that Heska does a blood test, and they have an oral version of the hyposensitization therapy, so your dog or cat does not have to get injections on a weekly, twice weekly, all of that good stuff basis. But that's been very helpful. Also, it doesn't sort of overwhelm the immune system. Miguel is asking about Apoquel helping, and it does help, but everything has its cost. There's been a fairly excellent safety record with Apoquel, but there has been some issues concerning elevated liver enzymes as well. A new therapy that's come out is something called Cider, which is a monoclonal antibody. And it is directed specifically to the interleukin, or the molecule that creates inflammation in the skin. So this is where therapy is going on the human side, particularly as it relates to chronic autoimmune disease, cancer, things of that nature, because we can target things more specifically. It has not been out on the market for about 6 months, but I am currently not seeing many reports of side effects, which is awesome. And that may change as time goes on, but that's the point of monoclonal antibody therapy, is that you are targeting the specific molecule that creates the issue, whatever it is you're trying to solve. And so by doing that, you're not, just putting a lead brick right on top of the rest of the immune system, as you would with something like a corticosteroid or cyclosporine, which is atopica, or Apoquel, which is a little bit more targeted towards the inflammatory molecules, but is still not as specific as this monoclonal antibody. So those are sort of more Western approaches towards controlling allergens. And then the other thing to remember too is that your pet may not have an overt food allergy, but it may have a sensitivity. And the way I used to explain this to my clients is this. So if we've got this baseline of, okay, everybody's happy, nobody's itchy here, and then this is sort of the trend of more things that can potentially irritate your skin. If you have a food sensitivity, and let's say this is the point where your pet has to reach to get itchy, if your pet has a food sensitivity, maybe it kind of takes things down here. So you don't really notice any effects as far as skin disease, GI disease, that sort of stuff. But back to that idea, okay, so we've got this elevated baseline of itch, if you will, and then we throw things that your pet is allergic to on top of that, like molds, dust mites, grasses, leaves, blah, blah, blah. Boom, now you're over the top of that itch threshold, if you will. And so sometimes by addressing other things that maybe aren't truly clinical, you can reduce that itch threshold so that the symptoms that your pet is experiencing aren't as severe, if that makes sense. That's kind of a weird concept, but Western medicine tends to look at things in sort of little boxes, and we forget to look at the fact that all the boxes are what happens is that patient's experience, or that person or that dog or that cat's experience. So the idea is to help kind of drop things down there. So that's what I can tell you. Bathing more frequently, wiping them down, apple cider vinegar rinse. Check out Earth Maiden for her Soothe Me Doggy salve, her excellent bar of soap. She's also got a nice spray that is a repellent for no-see-ums, and it does help somewhat with fleas and things of that nature. And that's the other big thing. September in South Carolina is actually when the fleas get worse, much to everybody's surprise and dismay. So even though you may or may not be seeing fleas on your pet, double check your flea therapy and see if that makes a difference. So for instance, if you're using a topical like Advantage, Frontline, that sort of stuff, if you notice you apply it, itch gets better, 2 weeks later starts to increase again, probably your dog has a sub-level of fleas. So then your choices are to reapply it or continue to use some other method to control the fleas. And frankly, Seresto collars in this area work extremely well, and they actually do last for 8 months. And I'll tell you a little story about the collars versus Advantage Multi in a second as well. So that's another thing too. Double check you don't have a flea issue, and then treat the environment for fleas. And you can do that with nematodes, and in the house things like borax and silicate crystals or flea busters powder. So lots of non-toxic ways to do that. Now the little story about the Seresto collar is I had a client I saw out at the farmer's market say that her puppet had this little lipoma, so this thing is kind of icky. It's a couple inches big, and it's it is what it is. It's not a cancerous tumor, but it's there, and they don't like petting it, but they didn't particularly want to do surgery either. So the fascinating thing is that they switched from using Advantage Multi for their heartworm and flea control to Seresto collars. And the fascinating thing is that tumor went away. So it's like, okay, what does that mean? The reason that's interesting is that Advantage Multi and Seresto have the same flea medication in them. The thing that's different is moxidectin, which is the heartworm prevention that's in Advantage Multi. So that has to be either that drug, the moxidectin, or simply the way that the Advantage Multi is applied on the back. Maybe more of the insecticide is being absorbed systemically than Bear wants to let us know. I don't know, but the tumor went away. They're using the Seresto collars now for flea and tick control, and then also heartworm pill of some description. So that was fascinating. I had ended up switching my own pets to Seresto collars. Tough to do that with the cats because they're not great about keeping collars on, but I thought that was cool. Now, Sally had a question about cats with fatty liver disease. And if the thing that's bizarre about fatty liver disease, if you've ever had a kitty that got really sick, this is always a risk. And what it is the cat is not eating generally. This is generally not something that causes the lack of appetite, but is more of a result of something else. So rarely, if they've been stressed, trapped outside, or trapped somewhere, it's possible for them to develop fatty liver disease in and of itself. But again, more often it's related to having had something else going on. So that's where it gets difficult to talk about. So the therapy for fatty liver disease is to get a meeting. And so we'll try that with things like mirtazapine, which is an appetite stimulant, and then force feeding them, which often is hilarious if you're watching the video, but not hilarious when you're trying to do it. And then offering really tasty stuff that's high in fat and protein. So, and then if that doesn't work, and time is short in this situation, then often feeding tubes are placed, and it's relatively, sounds horrible, but it's relatively easy to place a feeding tube through the esophagus into the stomach, or if you're working with an internist, they'll often place a tube from the stomach to the outside of the body wall, which again sounds horrible, but it's not as awful as it sounds, and the cats really tolerate them extremely well. So the upside is that then you can get your cat back eating again and start to correct this fatty liver disease. So what is fatty liver disease? Essentially what happens is, again, the cat has stopped eating, so it is metabolizing all the fat stores it's got, and essentially what happens is the liver literally gets choked off with fat because it's not able to break it down quickly enough. And so liver function kind of comes to a screeching halt. The liver enzymes go out the roof, and the bilirubin goes up, and often they will become icteric or turn yellow. So literally you will see a yellow stain around the whites of the eyes, and then in the ear tips on the non-haired part of the skin. And then you start looking more carefully and you see, oh gosh, this cat's yellow all over. It is a really serious disease. If you can get a meeting, many cats recover. And then the question mark becomes, what's the underlying disease that's causing this cat to not want to eat? And if you've corrected that, then most of these cats will go on and do well. If this is an old, kind of decrepit kitty, and has just sort of been wasting away and just borderline looking okay or not looking okay, it's tough to get them through that. And that's where subcutaneous fluids will also help, again, to help flush the liver out, try to get them eating with force feeding, that sort of stuff. There is an acupuncture point called Shangen that is at the junction of the haired, non-haired region on the tip of the nose. And so if you've got an acupuncturist you work with, if they needle that point and the cat just sits there like this, that's kind of prognostic for things are not going to go very well. But if they're like, ugh, and then you put a bowl of food in front of them, often they'll start chowing down, which is awesome. So that's kind of what I can tell you about fatty liver disease, but you got to make sure you've got both ends checked out. And I think I'm just going to scroll back and see if there's any other questions. If you guys have got other questions, please ask them. I think that's kind of all the excitement I can tell you for now. Hopefully the signal was reasonable throughout most of this. And literally, as I said that, the signal dropped out again. So if you guys don't have any other questions, you're welcome, Sally. And good to see you, and Susan and Miguel, and thanks for coming. Thanks for sharing these videos. We are getting ready to pull all of the library of YouTube videos. So these Facebook Live broadcasts have been turned into YouTube videos, so they're accessible there. And then over the next month, we're going to be bringing them over to the website, theoriginalcrockpetdiet.com, and we'll have available there transcripts and things of that nature. So you'll have all sorts of good stuff to take a look at here shortly. So with that, I'm going to bid you adieu. And Miguel, you're very welcome. I'm glad I can be of help to you. And remind you that your pet's best health starts in the bowl. So till next week, stay safe, enjoy this lovely fall weather, and we'll talk soon. Take good care.